Hi, I'm Dr. Fruth, family physician, and this is today's consultation. Today I'm going to talk about the sore throat. The medical term for that is pharyngitis. The itis part of that word refers to inflammation, and the pharyn refers to your throat. Now, there's many things that could cause pharyngitis. For instance, if you were to swallow something very hot, that might inflame the throat and cause pharyngitis. Acid splashing up from your stomach could cause pharyngitis. Allergies cause pharyngitis. If you have a sore throat that's associated with runny nose, cough, and no fever, that type of pharyngitis is more likely to be caused by the cold virus. Another virus that can cause sore throat is mononucleosis, and that kind of sore throat is going to be associated with swollen lymph nodes, headache, and some fever, aching, and a lot of fatigue. But the type of sore throat that most people are concerned about is that caused by the bacteria called Group A beta hemolytic streptococcus, or strep throat. In adults, only about 5 to 15% of sore throats are related to the strep bacteria, and in children it's 15 to 30%. Well, how do you know if you might have strep throat? A sore throat that's associated with fever, swollen lymph nodes, red and swollen tonsils that might have some film, and no cough and no runny nose, that's more likely to be strep throat. So what's the big deal about strep throat? Well, if left untreated, strep throat may develop into a complication called rheumatic heart disease, which is an inflammation of the mitral valve of the heart. Again, that's very rare in the United States because we have great access to healthcare and great access to antibiotics. But in some underdeveloped nations, rheumatic heart disease is actually a leading cause of death in young adults. Other complications of strep throat are glomerulonephritis and an abscess around the tonsils. If you think you might have strep throat, you'd want to see your doctor. And at that examination, you're going to have a test to see if it's strep throat. That often is a rapid strep test. The strep test has become so sensitive and specific over the last several years that if the strep test is negative, it's unlikely that you have strep throat if you're an adult. Most of the time, if the strep test is negative in children, most physicians are going to send it off for a throat culture. If your strep test is positive, you're going to be treated with antibiotics. And the drug of choice is penicillin. And most people, though, are going to be prescribed amoxicillin for a 10-day course. If you're allergic to penicillin or amoxicillin, you'll be given a different antibiotic. Now, if you aren't treated for your strep throat, you'll have symptoms for 7 to 10 days and be infectious for most of that time and even a little bit longer. But believe it or not, when you prescribe the antibiotic, it only shortens the course of illness by about 1 day. But the good thing is, if you do get your antibiotics started, you won't be contagious after about 24 hours. So again, a sore throat that's associated with runny nose, cough, and no fever is more likely to be related to a cold virus. But a sore throat that's associated with fever, red and filmy tonsils, headache, swollen lymph nodes, and no cough and no runny nose is more likely to be a strep throat. This is Dr. Fruth, family physician. This was today's consultation. Please like, share, and follow, but this video is for educational purposes, so please contact your healthcare professional for specific medical advice.